Joy, as Director of Senior Services for Cabell Huntington Hospital, what is your overall focus?
Our overall focus is to maintain the care of the seniors in the community that we serve and addressing every aspect of care. And that can mean everything from providing them with information to stay healthy to managing their chronic illnesses. We want to be the health care facility that seniors choose to come to. And in addition to that, being there for their family members. When a senior has to use health care, it's stressful not only for them, but for those that are caring for them and supporting them. So we want to make sure that we're doing everything within our means as a hospital to serve the seniors in our community, as outreach into the community and providing what they need, and as they become users of our facility and our services. And it's also important as a healthcare facility that we are prepared to meet their needs from a caregiving perspective. So a focus of ours is also making sure that our staff are equipped to meet their needs.
Is it different providing quality care for a senior than it is for other patients?
Well, it is. I mean, any of us who are aging understand that as the body ages, it feels different, it acts different, it responds differently whenever it gets an assault, whether that's a trauma or an illness. The aging body is very different than one that's in its prime in the 30s and 40s, if that's the prime. So we have to be equipped to be able to see the fine, subtle things that happen as the aging body gets ill. It doesn't always present the same way. A fever in someone who's 30 might be a clue that they've got an illness going on. But as we age, our bodies don't necessarily run a fever as we get sick. And so we've got to be able to understand the differences that happen as the body ages and changes.
Joy, has Cabell Huntington made the commitment necessary to put the resources in place and the team in place to be able to provide a higher level of care to seniors?
Cabell has made a huge commitment to seniors of our area, so much so that they have developed a whole department here that is in place to serve the needs of seniors. We have 3 full-time staff members, and that's a huge commitment for a hospital our size to put that many funds towards the needs of a senior population. I think that all the way from the top of our administration, though, to the entire management team, we all recognize that we're in a community that is made up primarily of seniors, and it's very important to us to make sure that we're where we need to be in providing their care.
I've heard it mentioned that Cabell Huntington is a niche hospital. What does that mean?
Well, niche is an acronym for Nurses Improving the Care of Health System Elders. And that's a program out of the Hartford Foundation of Geriatric Nursing at New York University. And they are the experts in the care of senior patients, specifically from a nursing perspective. But they're the folks that do all the research and write all the journal articles and research articles and the textbooks that the rest of us use to train and learn about how to care for seniors. And one of the things they've done is put together a program that hospitals can apply to and go through a rigorous process of meeting certain expectations from the hospital that would enable us to be recognized by them as people who provide excellent care to seniors. We've been able to achieve that status every year since 2005. We're very proud of that. We're the only we're the only hospital in the state of West Virginia to achieve a niche status, and really in the tri-state region. There's about 300 or more hospitals in the nation and some internationally. But anyway, that's a recognition that we're doing things, that we're putting resources where they need to be, and that we're putting priorities where they need to be when it relates to caring for seniors properly.
I understand that the foundation of the niche program is a training program for nurses that certifies them as geriatric resource nurses. Why is that significant, and does Cabell Huntington have a team of geriatric resource nurses here?
Well, geriatric resource nurses is a model that was developed out of the niche program. It's one of many resources that we have access to in being designated as a niche facility. But the geriatric resource model is very important because in healthcare today, we don't necessarily do the greatest job of educating nurses and physicians and other healthcare providers on how to care for the aging body. And so being a niche facility allows us to have that education piece where we can train our nurses specifically on senior related issues. And so the hospital made the commitment to set aside the resources to allow our nurses to go through that training program. It's a rigorous training program that requires a good 14 to 20 hours of a nurse's time to do reading and research and then take tests and prepare to get this certification. Currently, we've had over 100 nurses graduate from the program, and we anticipate graduating another 100 very soon. We anticipate that every RN will choose to go through this program, and the nursing division here at Cabell has made a commitment to fund the program and pay their nurses to go through this extra training. So we recognize our geriatric resource nurses as specialty nurses in the hospital, and they receive an in-house certification as GRNs, or geriatric resource nurses.
Each month, the Senior Services Department publishes a calendar in the newspaper that highlights a number of programs and events sponsored by your department and offered to area seniors. Tell me a little bit about the range of these programs.
The calendar is our opportunity to educate the public about many of the things that we have priorities for, and that is taking things out into the public that will inform people how to live healthier lives, how to manage their chronic illnesses, how to be aware if something is wrong, whether they should pay attention to it and seek medical care or not. So we do a lot of health fairs, we do a lot of health lectures and educational seminars out in the public. We offer several support groups to help people that have been diagnosed with a chronic illness to deal with it and know how to function with it, and also to provide support to their families so that they know how to act and behave and support their loved one who's got this new diagnosis to deal with.
You also every fall sponsor a big event called Senior Fest, which is upcoming this year, September 29th. Tell us a little bit about that.
Senior Fest is a commitment of the entire hospital. It is our way to show the community how much we value seniors here. And just about every department in the hospital takes an active role in that event to offer something that's interesting or fun or helpful to the senior patient or the senior member who comes to take part in this. We offer everything from health screenings, free health screenings that normally they would have to pay for, to educational information about a wide range of topics, everything from how to be a good grandparent, to know how to put your child in a car seat properly, to how to take care of your health and what you need to be monitoring for each year to prevent chronic illnesses from getting out of control, to how to child-proof your home, to how to set your home up to where you're not at risk for falls. I mean, it's just a wide variety of topics, and it's also an opportunity for physicians to be here and folks to come and be able to ask questions of them. We have pharmacists that take part, and they answer questions about people's medications. So Senior Fest is a day of fun, and it's a day of learning and a day of education. We offer, in addition to all the medical things that we offer some opportunities for people to socialize and have fun. Everything from games and bingo to drawing prizes for just everyone who's registered for the day. We just tried to make it a well-rounded event that people could just get out and socialize and learn some information while they're at it.
Joy, people across the tri-state see you frequently on television in a segment called Senior Moments. What's the purpose of this segment, and what kind of reaction have you gotten to it?
Well, the purpose of this segment is to sort of debunk the myth that senior moments are a negative thing. They typically, you hear seniors when they do something that's silly or embarrassing say, "Oh, I'm having a senior moment." But we felt that there's something that can be very positive about a senior moment. People are living longer. Our senior years are a good 1/3 of our life, so there's a lot of living to do in our senior moments, and we decided to take that negative connotation and turn it into something positive and use it as an opportunity to catch people's attention a little bit, but use our senior moment segments as a way to give people information that can help them live fulfilling and constructive and rewarding lives. We do everything from give them health information to featuring seniors that are living fulfilling lives and are contributing in the third portion of their life in a very fulfilling way. It's a time in people's lives when they choose to do what they want to do as opposed to what we have to do to support our families and raise our children. Now we're in a time where we look for our passions, and those senior moments are those passionate moments, those moments where we feel that we're giving something back to society, and it's something that we enjoy and enriches us. So the senior moments thing it sort of grew out of that negative connotation, and for us to say, hey, there's a lot more to being a senior than something negative. And so that's where we came out of that.
Are you hearing a lot from seniors in the community?
We get a lot of feedback. We get those senior moments have initiated a lot of phone calls to our office. We get phone calls probably every single day as a result of our senior moments, and people recognize us out in the community now, and they'll stop me in a restaurant and say, I saw your senior moment the other day, and they may ask me a question. So I think it's an opportunity for people to have an avenue into speaking to you. So yes, we've had a lot of positive feedback from them. I think that the tune is catchy now, and people tell me that when they hear that tune coming on their TV, they turn to listen because they want to see what we're going to deliver to them today.
Have you noticed that all of these efforts that we've talked about are starting to make an impact?
I'd have to say over the last year, as Cabell has had an intense focus on the senior population and more of an outward focus. We've been focused internally for many years, but we've made an effort to make sure the public understands that this is important to us. As we've done that, we've seen a tremendous amount of feedback and growth. We have seen a tremendous amount of seniors coming to our facility for their health care because they've begun to understand now that when they come here, they're special, and that we have made an effort to be very focused on what their needs are. You know, we get people say to us all the time, we're coming to your hospital because we know it's the seniors hospital. And that's exactly what we want people to understand. We're not doing this for the fun of it or the marketing of it. We're doing it because we're passionate about what we do here at Cabell to take care of people's health. And there are some of us whose total focus is to take care of seniors' health, and we want people to know that. And I would think that, you know, you're going to choose to go where people are focused on you.
You're obviously quite passionate about it. I imagine this is something that's quite rewarding for you personally.
It is. It grew out of the passion of caring for seniors has grown out of not only my own aging process, but that of my parents and my in-laws. Each of them faced their own individual challenges as they aged. And I spent a good bit of time as the medical person in the family, walking with them through their processes as they experienced chronic health issues and ultimately led to their deaths. I spent many years caring for my mother who had Alzheimer's, and it made me clearly understand what families go through, not only that patient, but those who are standing there watching the patient go, you know, the loved ones of the patient who are standing by feeling helpless, like they can't do anything to help them. And there are things they can do to help. I've learned that myself. And so that has sort of spurred on my passion for seniors. It's very rewarding to work with seniors because you begin to realize that this idea that you had about seniors when you were younger, it's very different when you experience the aging process and get to know seniors as friends. They're just teenagers in older people's bodies is all they are, and we still have the same dreams and wishes and desires. And when you see them feel challenged with navigating the complicated healthcare system that we have today, it's just natural that you want to help them. And whenever you're able to help somebody and you realize that you can take away a little bit of their burden and a little bit of, just give them a little bit of peace, it's very rewarding. And as a nurse and as a daughter of an aging person, that's really all that's important for me, is to be able to know that I'm making a difference in someone else's life. And I think that's true not only of me, but of the team that works with me and of those that are here that are very passionate about seniors, those geriatric resource nurses. I think it's many of us, it's hit home to us what it means to age. And so with this increased focus that we have here, I think it's heightened all of our awareness that there's this whole thing out there that we've always just thought happens to everybody else.
And I know that you and your team all welcome calls from seniors when they have questions about care or any questions, really. How do you reach the Senior Services Department?
It's very easy for seniors to access us. They can call us at our number here at the hospital at 526-2695. They can access us through our website or through email, or even just coming into our office, walking in off the street. We love to talk to seniors every day. We enjoy helping them, and we have, being the healthcare facility and the presence in Huntington that our hospital has, we have the resources with our partnership with the university and other healthcare providers to be able to connect people. We may not have all the answers for them, but we're willing to go the extra step to get them connected to who they need to be connected to. And I think that's what makes us different than many other facilities, is that we've got people that are passionate enough to go the extra mile. And it's really not that hard to do, and that's what we do. And we want people to know that they can feel comfortable calling us about anything. If they don't know where to turn, they can call us. We'll figure out what we need to do to help them get where they need to go.
Joy, thanks.
Thank you.